Hi, it's Jane, and on Healthier You today, we're going to talk about sleep apnea. As many of you already know that follow me, I was diagnosed with sleep apnea, and this is a fairly new diagnosis for me. And my sleep apnea, I do not stop breathing. My the oxygen level just goes way down to like 62%. And you do want your oxygen level to be at least 90%, but most often they prefer it to be 92% while you're sleeping or at rest. But I had a sleep study done quite a few years ago, and the sleep study was a flawed sleep study, mainly because of the extraneous noise that was outside of the room, and I never got to sleep. Which the doctor, got really angry with me when I told him what the issues were, which really he should have just addressed it instead of getting angry with me. Although I was the first patient he came in and talked to, I do know that the other patients did talk to him about the same issues. So there's that. But instead of, redoing the sleep study in a quieter setting, that kind of thing, he just chose to take it that I don't get restorative sleep. So for years, we've gone on the theory I don't get restorative sleep. So I've probably had sleep apnea since 2008. It's quite a while. At this juncture, it may have gotten worse over time. May have been just slightly, who knows. But I did know that I snore, because there's times when I've been sitting in my recliner, lean back, relaxing, and I will fall asleep and wake myself up snoring. So I do know that I snore. And I had no really worries, because like I said, I didn't ever wake up gasping for breath. So there was that. But with the diagnosis of the amyloidosis, which I do not have, thankfully, the cardiologist, wanted me to redo a sleep study. And she'd asked me about going into a facility, and I told her, nope, not willing to do that. So we did a home sleep study, which worked out perfectly for me because I was comfortable in my own home, that kind of thing. So we're going to talk about sleep apnea. And believe it or not, you remember how I have been harping the past year or two about sleep is important to weight loss? Yes, it is. And sleep apnea can cause weight gain in some people, and also the inability to lose weight, which I thought I was just at a plateau at the point. Even though I've been documenting my food intake, all that kind of stuff anyway, and I know I wasn't overeating. My average for calories per day is 12 to 1400, which is well within the scope of still losing weight for me. So anyway, all right, let's get on with the medical disclaimer. Always check with your physician before starting any exercise or dietary program. Information here is my personal research into different health topics and is not to be considered medical advice. Now, it's dark and gloomy here where I'm at today. It's raining, so. And this comes from the American Thoracic Society, Weight Loss and Sleep Apnea. Obstructive sleep apnea is a common problem that affects a person's breathing during sleep. Person with OSA, which is obstructive sleep apnea, has times when airflow to the lungs is blocked due to the collapse of soft tissues in the air passages during sleep. Treatment of this depends on what is causing it. If you have problems with it from being obese and overweight, weight loss can be an option to help manage your OSA. Losing as little as 5 to 10% of your body weight can improve or resolve it. Now, I've already done that 4 or 5 times over. So, we're still looking at that as an option, and I'm still working on it. This fact sheet discusses how managing your weight can help treat OSA. What type of program can help me lose weight? Research shows that people lose the most weight. They take part in a complete lifestyle intervention program that has all of the following: a restricted calorie diet, do it, increased physical activity, yeah, and behavioral therapy, yep. Behavioral therapy involves working with a weight loss specialist to learn how to track your calories, activity levels, and weight, as well as identifying your specific weight loss challenges and strategies to overcome them. A number of effective commercial weight loss and behavioral therapy programs are also available. Done those, didn't find them that helpful. We talked about the one where the doctor told me I wasn't eating enough. So I began eating the 1,500 calories she wanted me to eat per day, and I promptly gained about 40 to 50 pounds. So, as always, it helps if you do have a weight loss program that offers you frequent visits with a weight loss specialist and provides long-term follow-up associated with the greatest success. And I will tell you, this weight management program that I was on, they pushed bariatric surgery. I was not willing to do bariatric surgery for several reasons. One of those were the doctors that were performing it. Their kill rate was awful high, and I don't know if that's because they took on some of the worst, most dangerous weight levels for that, or if it was their procedures that they were doing, but I didn't like those odds. There were a lot of other issues that I had at the time. It was not going to help with the GERD, which I do have, and I have a sliding hiatal hernia. So I was concerned about, being on a bariatric diet, which is a very restrictive diet, and you have to really watch your protein intake and some of the other things that you need to do for just the normal elements that your body needs. Potassium, magnesium, all those kind of things. And I was already having magnesium issues. Some of that was caused by the medication they had me on for the GERD, which was fine, but it was a medication that worked for me. Some of the others did not work for me at all. Which, if any of you are on Nexium depletes your magnesium. It's just a side effect of it, and they thought it was just the side effect of the Nexium. Tried to put me on a couple of other medications. They did not work. So, there you have it. But I was concerned about that, and then having the gastroparesis. The doctors at the time, one of them who was an expert in gastroparesis, said, you really should not consider this bariatric surgery because of your gastroparesis. It could actually put a complete stop to your stomach as it is now. Let's get you out of the gastroparesis, that kind of thing. So, but anyway, those are some programs that you can do, as well as a lot of them. Eating disorder clinics can help you with the overeating. And of course, there are other medical programs that many places have that can help you. Take a look at all those kind of things. To further increase your chances of success, Choose a program that best matches your preferences and lifestyle. For example, some people may prefer a self-directed weight loss program or an online program that includes the 3 components noted above. And a lot of people overlook Overeaters Anonymous, which for most part in most places is now online exclusively, especially since COVID. I don't know of any groups that meet on a regular basis anymore. But that can help you with a lot of those things, the mental, spiritual aspect of overeating. All right, so talk to your healthcare provider as always before you plan to start any weight loss program. This is especially true if you have a chronic disease such as diabetes, heart disease, or considering a very aggressive or extreme weight loss program. What type of diet should I follow to lose weight? And this is where I have done I've done a video about the buzzwords, like calorie deficit. Now we're no longer using diet or calorie restrictive. Now it's calorie deficit is what I'm hearing a lot of. So decreasing your calorie intake while maintaining a nutritious, well-balanced diet can help you lose weight. In general, total calorie intake should be limited to 1,200 to 1,500 calories per day for women, 1,500 to 1,800 calories per day for men. You need to continue for at least 6 months in order to lose weight safely. Safely, people. Some of these other diets, like the Metafast, those kind of things, you need to be under a doctor's care and provision for those for it to be safe. And there are some doctors that don't do it because it's safe. They do it because it's a moneymaker. So be careful with what you choose. Choose the type of diet that you would be most likely to follow. In other words, it's going to become a lifestyle for you. It's not going to be, I'm just going to do it till I lose the weight and then I'm off. Because you're going to have to continue that regardless. So make sure that it's something that you can follow for the rest of your life. If you love meat, maybe a carnivore diet's for you. I follow a low-carb diet. I don't think the American Diabetes Association, the diet plan that they follow, is actually very good for a lot of diabetics, someone like me. I think it has too many carbs. So for me, that's not an option. I choose to limit my carbs per day, and that has helped me tremendously. So you got to find something that's going to work for you. And yes, I can work with it for the rest of my life. And yeah, I still have sweet potatoes on it. Studies show that weight loss occurs because of the calorie restriction, not because of a particular type of diet or program offered. Your weight loss specialist can teach you how to count and track your calorie intake. There are also computer programs and cell phone apps, tons of them. One of the best ones I can think of is Spark People, and I don't think it costs yet. There are a lot that you have to pay per month for use of those apps, but if you're willing to do that, have the money, go for it. Tracking your food intake, food diary for 2 weeks can give you clues as to changes you may need to make. In other words, if you're just starting out on your journey, you may need to track what you've been eating on a regular basis for 2 weeks, so you have an idea of what you're eating. You may be doing what's called unconscious eating. You don't think about the couple of bites, 2 or 3 chips that you have here or there spread throughout the day that equal a full serving. You don't think about the, it's just a little bite of a cake. I have it twice a day. What's a big deal? That kind of thing. They all add up. So it's important to know what your baseline is before you start your weight loss program. Your food diary, well, it should include all meals, snacks, and beverages that you eat and drink, as well as type of food, total calories for each, time you ate, and why you ate. The why may get you. Review your food diary with a dietitian or other weight loss specialist to get advice for how best to change your diet. Common diet goals or calorie deficit. Set a healthy weight loss goal of 1 to 2 pounds per week. Eat at least 3 meals per day. Eating frequently smaller meals has not been proven to cause more rapid weight loss. Do not skip meals. Let me repeat that. Eating frequent smaller meals has not been proven to cause more rapid weight loss. And that is one thing that American Diabetes Association promotes is 6 smaller meals per day. Common dietary mistakes often include skipping meals. Do you not eat breakfast in the morning? Underestimating your daily calorie intake. That's usually the culprit, underestimating your calorie. Eating a lot of refined, processed, and or sugary foods. Not eating enough fresh fruits, vegetables, protein, and or fiber, which may have to do with money issues. I mean, come on, folks. Right now, we're at a point where things are pretty high. And I don't know about you, but I could eat bell peppers every day of the week. But I could eat 1 bell pepper a day. But right now, they're almost $2 a piece. So, you got to look at some of those issues there too. And if you have those issues, look to see if there's some place that can help you. Maybe a food co-op where you can get fresher foods, fresh farm foods, on a monthly basis that you may be able to afford more easily. Also, look into the possibility of maybe you can get food stamps. Don't be afraid to get them. Not drinking enough water to stay well hydrated. We've talked about how water is very important for flushing out those things. So yeah, drinking alcohol or fruit juices or a sugary soda is a culprit. Frequent snacking between meals. And here's the biggest one, adding high-calorie condiments, dressings, or sauces to your food. So many people are afraid of just eating food by itself, So, yeah. General strategies to promote healthy eating. Control your portions. Portion control is an important factor in controlling your calories. Read your food labels to better understand portion sizes and calories. Also, you may find that eating from a smaller bowl or plate is helpful. Right now, a lot of the plates that we are served are 12 inches or more, and that's certainly probably the size of 2 meals instead of 1. So maybe we should consider going down. The biggest thing I've seen is to use a 9-inch plate. Those are easy to find. Plan ahead. Cooking your own meals allows you to control the number of ingredients and avoid hidden calories. Plan snacks ahead of time so you don't be caught hungry without a healthy option. And there are some healthy options, but sometimes we feel like it's not enough. And that's where mindful eating comes in. Because a handful of nuts, is very different than a serving size. Because I know I can get 2 serving sizes in my hand. So serving size does make a difference at portion control. Drink water to keep hydrated. Limit caloric beverages such as juices, sodas, and shakes and alcohol. Avoid late evening meals. Eating late at night may contribute to weight gain. possibly due to the body's lower metabolic rate at night. And if you have sleep apnea, that's going to affect that metabolic rate during the night. So that's something to consider. Avoid distractions such as watching TV during meals. This can lead to overeating. Choose meals that are high in fiber, complex carbohydrates, and low in sugar. Complex carbohydrates such as brown rice, quinoa, whole grains, sweet potatoes, and oatmeal are healthier options than processed. Simple carbohydrates such as white bread, cereals, crackers, white potatoes, and white rice. And I will say this, generally for breakfast, I like oatmeal. That's something that I eat a lot of. And generally, you have to watch that portion size. Look at what the portion size actually is. And I'm not one that I like Quaker oats. I think they taste like cardboard. And that's because I usually eat Irish oats, which are higher in protein than the processed oats that we get in our store. But if that's what you eat and you're fine with it, continue. Go for it. Strive to make every meal and snack well balanced with protein, fat, and carbohydrates. Limit your high-fat foods. Choose grilled or baked foods over fried foods. Clear, low-calorie dressings. Vinaigrettes over creamy, high-calorie dressings, such as ranch, and clear broth-based soups instead of creamy, thick soups. And sometimes that can be hard to do. Address any special dietary needs that you have about diabetes, high blood pressures, food allergies as part of your overall healthy eating plans. After you lose the weight, you want to follow up with a program to maintain your healthier state and have repeat sleep study to see how much improvement you have had in your obstructive sleep apnea. Physical activity and exercise. Increasing your levels of everyday physical activity and exercise are positive goals for everyone. Exercise can help you maintain a healthy weight and benefit your health in many other ways. However, it must be combined with a healthy diet to achieve weight loss. Studies have shown that in people with obstructive sleep apnea, exercise alone results in little to no improvement in weight loss or in your severity of your obstructive sleep apnea. Here are some ways to increase your daily activity. And they're simple. Take the stairs instead of the elevator. Park at the end of the parking lot to encourage more walking. Carry your grocery bags. Take breaks from sitting at your desk and stand or walk throughout the day. Get an exercise buddy. You can keep each other going and enjoy the time together. And I've noticed a lot of people are calling this your accountability buddy. Whatever name you want to call it, whatever works for you. Ask your healthcare provider about exercises that are safe for you. Walking generally is a great exercise, and 30 minutes a day, 5 times a week, can also help improve your high blood pressure, reduce stress, and also improve your sleep quality. Additional weight loss measures. For some people who are very overweight, healthcare provider may recommend adding a weight loss medication or a weight loss surgery. These may be considered for a person who has failed to lose weight despite carefully following a good weight loss program. And that's true. Some of the things you can do, action steps that you can adopt and stick to a healthy diet and regular exercise. Ask your healthcare provider how you can get started. Select a weight loss program that includes a weight loss specialist or counselor who can offer advice and support with frequent meetings over time. And sometimes, if you've just asked your doctor for a consult with the dietitian, dietitians can help you with quite a bit. If you have diabetes, look to see if there are any diabetic programs in your area. Many of those are absolutely free. Um, Many of them are underwritten by the government or by local universities. Check and see if there is a program around you. Um, Before COVID hit, at one of our malls, one of the hospitals had an ongoing diabetic program, weight loss program, program for those who had high blood pressure to come in and get their blood pressure checked while they were walking in the mall. Of course, now the mall is practically dead. In fact, I think it is completely dead now. Maybe not. I think they still have Burlington stores, but I don't think they've got much else. Movie theater, Dick's, but pretty much most of the storefronts in the mall are empty. But so, and I heard last time I heard is it had been sold. Someone was going to take it and turn it into an apartment complex. Who knows? Maintain a positive attitude. You have the power to eat healthfully, lose weight, and feel better. Change is possible. Increase your levels of physical activity and exercise, and as always, work with your healthcare provider. There are a lot of places for online sources for weight loss, as well as the American Thoracic Society, and I'll leave those links down below this article. National Heart, Lung, and Brain Institute, the American Heart Association, the Academy of Nutrition and Dietetics, American Diabetes Association, American Society for Metabolic and Bariatric Weight Loss. So now we're going to talk a little bit about, hang on. Sorry, I had to change the battery. Now we're going to talk about why excess weight causes sleep apnea. Several health conditions increase the likelihood of developing sleep apnea. One of those is being overweight or obese. Excess weight creates fat deposits in your neck called pharyngeal fat. Pharyngeal fat can block your upper airway during sleep when the airway is already relaxed. This is why snoring is one of the most common sleep apnea symptoms. Air is literally being squeezed through a restricted airway, causing a loud noise. And on my sleep study, it stated that I had very loud snoring. 25%, folks. Additional increased abdominal girth from excess fat can compress your chest wall, decreasing lung volume. The reduced lung capacity diminishes your airflow, making the upper airway more likely to collapse during sleep. And the obstructive sleep apnea risk continues to increase with your rising body mass index. Less common causes of sleep apnea are enlarged tonsils that block the airway, anatomical features such as a large neck or narrow throat, endocrine disorders including diabetes and thyroid diseases. Can I have both of those? Isn't that wonderful? While excess weight has long been known to be a risk factor for sleep apnea, an increasing amount of evidence suggests the relationship is reciprocal as far as weight gain. This is because sleep deprivation is associated with decreased leptin, an appetite-suppressing hormone, and increased ghrelin, an appetite-stimulating hormone, which may increase cravings for calorie-dense foods. Additional data indicates that insufficient sleep leads to overeating, obesity, and a decrease in fat loss during calorie restriction. It also appears that in sleep apnea patients in particular may be more susceptible to weight gain than people who have the same BMI and health status but do not suffer from sleep apnea. This is illustrated in one study that showed people with sleep apnea gained significantly more weight, around 16 pounds, in the year leading up to their sleep apnea diagnosis compared with BMI-matched people without sleep apnea. That's interesting. Sleep apnea can also deplete people of energy they need to maintain a healthy body weight. Daytime sleepiness is a common sleep apnea symptom, resulting from fragmented, unrefreshing sleep. Excessive sleepiness may lead sleep apnea sufferers to exert less physical activity during waking hours. This can be particularly problematic for those of us who are obese, who frequently experience more shortness of breath and chest discomfort with physical effort, resulting in limited exercise. Without dietary changes, decreased activity levels can lead to additional weight gain. Health risks of sleep apnea and excess weight. Well, we already know a lot of those about excess weight, but there are more that come with the sleep apnea. Deprived of sufficient quality rest, sleep apnea sufferers experience significant stress on their cardiovascular, metabolic, and pulmonary systems. This may be particularly worrisome for obese patients because obesity can also elevate that risk of heart, lung, and metabolic problems, potentially compounding your health issues. Sleep apnea and cardiovascular health. Sleep apnea affects your entire cardiovascular system in quite a few ways. Each time breathing lapse occurs, the body's oxygen supply drops, triggering a fight or flight response. When this response occurs, blood pressure surges, heart rate increases, causing the sleeper to awaken and reopen their airway. The cycle repeats throughout the night. The cyclic rising and falling of blood oxygen levels can cause inflammation, which in turn may lead to atherosclerosis, a buildup of plaque in your blood vessels, which is associated with heart attack, stroke, and high blood pressure. Let me get a drink. Sleep apnea also elevates carbon dioxide and glucose levels in the blood, disrupts the part of the nervous system that controls heartbeat and blood flow, increases insulin resistance, and alters the flow of oxygen and carbon dioxide. As a result, sleep apnea is associated with the following heart, lung, and metabolic problems, among others: high blood pressure, atrial fibrillation and other arrhythmias, heart failure, stroke and transient ischemic attacks, known as mini strokes or TIAs, coronary heart disease, type 2 diabetes, metabolic syndrome, obesity, hypertension, diabetes, and dyslipidemia. Obesity, hypoventilation syndrome, and sleep apnea. Sleep apnea often coexists in people with obesity, hypoventilation, which is called OHS. Excess weight puts pressure against a person's chest wall, compressing their lungs and therefore interfering with their ability to take deep, well-paced breath. Up to 90% of people with OHS also have sleep apnea, but not everyone with sleep apnea has hypoventilation syndrome. The risk of OHS is correlated to BMI, with the prevalence rising to almost 50% in those whose BMI is greater than 50. Like sleep apnea, OHS can cause high blood pressure and heart failure, and it can decrease oxygen while elevating carbon dioxide levels in the blood. Patients afflicted with both of these conditions have a significant risk of cardiovascular disease. Can losing weight cure sleep apnea? Treating sleep apnea, like treating many diseases, starts with lifestyle and behavioral modifications. For most obstructive sleep apnea sufferers, this includes working toward a healthy body weight. Weight loss reduces fatty deposits in the neck and tongue, which can contribute to restricted airflow. It also reduces your abdominal fat, which in turn increases lung volume and improves airway fraction, making the airway less likely to collapse during sleep. Losing weight can also significantly reduce many obstructive sleep apnea-related symptoms, such as daytime sleepiness, irritability, or other sorry about that, other neuropsychiatric dysfunctions. There is an overall improvement in cardiovascular health, high blood pressure, insulin resistance, type 2 diabetes, and in particular, quality of life. Weight loss of just 10 to 15% can reduce the severity by 50% in moderately obese patients. Unfortunately, while weight loss can provide meaningful improvements in obstructive sleep apnea, it usually does not lead to a complete cure, and many sleep apnea patients need additional therapies. Does weight loss method matter? With several options for losing weight, many obstructive sleep apnea patients want to know which is the one best for sleep apnea. Some of the best weight loss methods include dietary changes, increased physical activity, medications, and surgery. Will treating sleep apnea help you lose weight? That's a big question. Evidence suggests that obstructive sleep apnea patients who effectively manage their sleep apnea may find it easier to lose weight. In one study, ghrelin, a hormone that stimulates appetite levels, were higher in obstructive sleep apnea patients than in people without sleep apnea of the same body mass, but fell to comparable levels after 2 days of using a CPAP treatment. Conflictingly, long-term use of CPAP, the most effective sleep apnea treatment, has also been associated with weight gain in some studies. However, the reasons for this association are unclear, and more research is needed. Given the complexity of weight and sleep apnea treatment, overweight patients should not solely rely on CPAP therapy or apnea treatments as their sole method of weight control. And here's the big kick. Don't wait to seek care. When it comes to sleep and weight, early intervention is key for preventing harm and reclaiming quality of life. With adequate treatment, sleep apnea carries an excellent prognosis. It's never too late or too early to take an active approach to weight control. If you think you have sleep apnea, it's important to see your doctor for an accurate diagnosis and tailored treatment options. All right, that is it for today's Healthier You. I hope it gave a few of you a little bit more information about sleep apnea and whether you might need to look and see if you actually do have sleep apnea. A lot of people don't. Like I said, I never wake up gasping for breath, ever. And usually that's a telltale sign. But then again, I'm tired all the time, which we blamed on fibromyalgia, which that is something that happens with fibromyalgia. But even though I am tired all the time, exercising, watching what I eat, those kind of things Weight loss has been slow and hard. And like I said, I think that I've reached a plateau level right now, which is fine. I'm still continuing what I'm doing, looking to see if there's some ways to improve things. And I do think there are a couple of ways to improve that, and I will be implementing those. But yeah, you know, if someone told me that I had sleep apnea, I would have said, nope, don't. I don't wake up gasping for breath. And here it is. I have sleep apnea. All right, guys, that is it for today. Hope you guys have a great week. I'll see you again soon. Bye.